Those in long-term care are a priority for vaccines. There are questions around why some of Ontario's other vulnerable residents are not.
People living with disabilities, often in group settings, not among those first in line to get a shot. CTV's Mike Walker is live outside Participation House in Markham with more. Mike.
Well, there was a deadly outbreak at this group home last spring. The executive director says a majority of the people they care for are seniors and believes without the vaccine, there's a prospect for future outbreaks. Leah Nutson's daughter, Bergen, lives at a Participation House group home for adults with disabilities in Markham that experienced the COVID-19 outbreak in November. Bergen is not eligible to receive the vaccine in the first phase, and that worries her mother.
It's really concerning, especially with this new variant that's coming around.
Long-term care home residents and staff are the priority, but there is concern that medically fragile adults like Bergen, who live in congregate care settings, are being forgotten.
Society is always overlooked. So is their life less valuable because they are disabled?
During an outbreak in April at Participation House, largest group home in Markham, nearly every resident was infected with the virus and 6 died. The executive director says a majority of residents are seniors with serious disabilities and is frustrated that group homes have to wait until in the second phase, saying in a statement, COVID-19 poses an incredible ongoing threat to the health and well-being of our residents and clients who share all of the risk factors identified for those living in long-term care. York Region planned to roll out the vaccine to facilities, including Participation House, last week after long-term care homes were immunized, but that plan was halted due to shipment delays of the Pfizer vaccine and direction from the province.
The province has to have some line of sight on any potentially available vaccine doses that it can reallocate to those health units where they have insufficient doses.
In a statement, the Ministry of Health says due to limited supply, the province focused on vaccinating those who are at high risk, including long-term care residents and staff. And with more uncertainty about future shipments, the priority is on the most vulnerable and administering second doses.
I don't see any great movement occurring until after the province gets some reassurance that the Pfizer supplies that they are now being promised after mid-February will be here.
Meaning there is still uncertainty for group home residents and staff. York Public Health is currently working on a plan to roll out the vaccine to congregate care settings, and that York's top doctor says that will depend on supply and shipments, and the earliest that could potentially happen is in March. Reporting live, I'm Mike Walker. Zoraida,
Barrie's mayor is urging residents to take COVID-19 guidelines seriously amid concerns the more contagious UK variant is spreading through the community.
There's no question anymore. Everybody knows what we need to do. And this is the time for, even though everyone's tired, everyone is very tired, this is the time for maximum effort.
The UK variant has been confirmed at Roberta Place long-term care home, where 46 residents have died, as well as 1 essential caregiver. But at least 99 potential variant cases have been logged in the community, and not all of them have clear links to the long-term care outbreak. And a reminder, our online team is staying on top of every development with Ontario's response to COVID-19. You can find that at our website, ctvnewstoronto.ca.